Safety regulations in clinical laboratory. Safety in lab. Wear lab coat. Wear slippers inside the lab. Tie the hair properly. Off the sprit lamp after heating. Close the chemical bottles after use. Keep the inflammable chemicals in a safe place. Don't take food inside the lab. Wash the hands with the soap after completing experiments. Handle the samples with the gloves. Dispose the samples safely in the separate vent after sterilization. Don't dispose the samples in toilet or bathroom. Disposal of sample. Dispose the samples in incinerator. Put the sign board on the machines under repair. Use the manuals for the proper use of instruments. No food or drink. Consuming food in the lab can pose many hazards. Eating or drinking in the lab can first and foremost increase your risk of exposure to hazardous materials. Food or drink can leave a mass, increasing the risk for contamination of your experiments and potentially attracting pests. Eating or drinking in the lab can also be a distraction that can lead to a spill or more serious incident. Wear your PPE and proper lab attire. Lab coat, gloves, eye protection, and appropriate attire should be worn at all times in the lab. Long pants and shoes completely covering the top of the foot should be worn at all times when working in the lab. Lab coats will protect your clothes and your skin from splashes, spills, or other exposures to chemical or biological agents and flames in some cases. Safety glasses or goggles will protect your eyes from physical or chemical harm. Skin will heal after minor burns or lacerations, but your eyes will not. Eyes are fragile, and safety glasses take about 3 seconds to put on. An eye injury can be permanent. Gloves protect your skin from hazardous materials your hands may come into contact with. However, exposure can occur when removing gloves and disposing them. Follow the steps in the video below to properly remove any gloves used in the lab. Wear your PPE and proper Food hygiene. Wash hands after handling any hazardous materials before and after eating and before leaving the lab. Keeping personal items separate from lab work. This will prevent spread of hazardous reagents and cut off a potential exposure route. Do not apply cosmetics while in the lab. Applying anything to your face, especially around your mouth or eyes, pose a significant risk of exposure. Dry and cracked skin can provide a route to exposure. Using lotion to keep the skin on your hands healthy can help prevent exposure. Use proper storage containers. This applies to individual containers, storage cabinets, and waste. Storing organic solvents in plastic bottles can compromise the container, just like acids in metal containers or HF in glass. Chemicals should be stored in containers made of materials that will not react. Large volumes of flammable chemicals must be stored in the fire rated cabinets. Acids and causatics should ideally be stored in separate cabinets lined with plastic or prevent any vapors from the reaching with the metal causing chemicals known to react violently when mixed should be stored separately. As with the chemical storage, waste should be stored in not reactive containers or in containers with non-reactive materials. Label your workspace. All containers should be labeled with their contents. This is crucial so those working near you and anyone visiting the lab will know what hazards may be present. Ideally, the hazards present should be included on any label. Any research process with the particular hazard should also be labeled with that hazard. Don't work alone. During normal operations, one should never work alone in the laboratory setting. Additional eyes in the situation may notice hazards which you can not initially see. Having other researchers around will also provide faster support in the event of an emergency. Adapting to situations when it is necessary to reduce the number of researchers in a space requires modifications to this policy. Notify your PI on supervisor before entering the lab and upon the departure. And communicate with the neighboring labs for so everyone know when someone will be in the general area. Thank you. Sarane.